Vaccination is an effective way to avoid a wide range of infectious diseases. You can obtain protection or immunity from a disease if you've been vaccinated against it. The Food and Drug Administration, FDA, in the United States has given emergency use authorization to 2 vaccines against the virus that causes COVID-19. These vaccines are the Pfizer-BioNTech and Moderna vaccines. A COVID-19 vaccine is a vital tool in the effort to stop the spread of the new coronavirus known as SARS-CoV-2. However, you might be concerned about the vaccine's safety and possible short- and long-term side effects. It's pretty normal to feel mild symptoms after getting a vaccine. Although it can be unpleasant, it's actually a good sign. It means that your body is in the process of generating an immune response. Although these side effects may be bothersome, they are usually minor or moderate in nature and disappear after a few days. Here are the 10 most common side effects that you may experience within a day or 2 of getting the vaccine. Number 10. Pain, redness, or swelling at the injection site. An injection site reaction is typically described as any discomfort, swelling, rash, bleeding, or redness at the injection site, however severe reactions may occur. For an intramuscular or subcutaneous injection, a slight amount of pain or redness is to be expected. And an alert to this effect is included in the vaccine information statement for the majority of vaccines. A cold compress, as well as an OTC pain reliever for pain or an antihistamine for itching, can be recommended by the pharmacist for a patient who is experiencing pain, redness, or itching. Applying pressure to the injected spot until it stops bleeding, and then covering it with an adhesive bandage or compress can help to stop the bleeding. Number 9. Fatigue. Fatigue is a term that refers to a general feeling of tired or a lack of energy. It's not the same as feeling sleepy or drowsy. When you're tired, you don't have any inspiration or resources. Sleepiness is a sign of exhaustion, but it is not the same as fatigue. Fatigue is a typical symptom of a wide variety of medical conditions, from mild to serious. It's also a common product of those lifestyle decisions, such as inactivity or a poor diet. If your fatigue doesn't resolve with proper rest and nutrition, or you suspect it's caused by an underlying physical or mental health condition, see your doctor, and they'll assist you in determining the source of your fatigue and treating it. Number 8. Fever. Fever is also known as hyperthermia, pyrexia, or elevated temperature. It describes a body temperature that's higher than normal. A temporary rise in body temperature may aid in the battle against illness. On the other hand, a high fever may be a sign of a serious illness that necessitates urgent medical attention. The average body temperature is around 98.6 degrees Fahrenheit, that is 37 degrees Celsius. However, each person's natural body temperature varies slightly. The temperature of a normal person will change depending on the time of day. In the morning, it is lower, and in the late afternoon and evening, it is higher. Body temperature may also be affected by other factors, such as the menstrual cycle or strenuous exercise. Fever occurs when a part of the brain called the hypothalamus shifts the set point of your normal body temperature upward. You may become chilled and add layers of clothes, or you may begin to shiver to generate more body heat. This leads to an increase in body temperature. The severity of a fever determines how it should be treated. A low-grade fever with no other symptoms usually does not necessitate medical attention. A fever will normally be treated by drinking plenty of water and lying in bed. Number 7. Chills. The term chills refers to a feeling of being cold without an apparent cause. You get this feeling when your muscles repeatedly expand and contract and the vessels in your skin constrict. Chills can occur with a fever and cause shivering or shaking. The chills in your body may be constant. Each episode can be up to an hour long. Chills can also happen on a regular basis and last for several minutes. Chills can occur after being exposed to a cold climate. They can also happen as a result of a fever caused by a bacterial or viral infection. Treatment is usually based on whether your chills are accompanied by a fever and the severity of the fever. If your fever is mild and you have no other serious symptoms, you don't have to see a doctor. Get plenty of rest and drink plenty of liquids. A mild fever is 101.4 degrees Fahrenheit, that is 38.6 degrees Celsius or less. Cover yourself with a light sheet and avoid heavy blankets or clothing, which can raise your body temperature. Sponging your body with lukewarm water or taking a cool shower may help reduce a fever. However, cold water may trigger an episode of chills. If your fever and chills don't go down after 48 hours of home treatment, see your doctor. Number 6. Headache. Headaches are uncomfortable pains in the head that cause pressure and ache. The pain can be moderate or extreme, and it typically affects both sides of your brain. The forehead, temples, and back of the neck are some of the places where headaches can occur. The duration of a headache can range from 30 minutes to a week. According to the Mayo Clinic, the most common headache type is a tension headache. Triggers for this headache type include stress, muscle strain, and anxiety. A headache may be a symptom of an illness or another medical problem. By taking a medical history and conducting a physical examination, a doctor may be able to assess the root cause of a headache. It's also crucial to get a thorough history because the sudden absence of medicine or certain foods can result in chronic headaches. For example, heavy coffee drinkers who suddenly stop drinking coffee can experience headaches. Number 5. Migraine. Migraines are different from other headaches. These headaches are intense or severe and often have other symptoms in addition to head pain. Migraine headache pain can range from mild to extreme as compared to tension or other headache forms. Migraine headaches will typically affect only one side of the head. However, it is possible to have a migraine headache that affects both sides of the head. Other differences include the intensity of the pain. A migraine headache causes intense pain that can throb, making it impossible to carry out everyday activities. People who have migraines less frequently can benefit from medications that are known to quickly relieve migraines. If a person takes migraine headache medications more than 10 days a month, this could cause an effect known as rebound headaches. This practice will worsen headaches instead of helping them feel better. Number 4. Body aches and pains. Body aches are a common symptom of many conditions. The flu is one of the most well-known conditions that can cause body aches. When you're stressed out, your immune system can't control its response to inflammation as well. This can cause your body to ache as it becomes more susceptible to inflammation and infection throughout your body. To relieve your body aches, you can just need some rest and home care. However, some aches, especially those that last a long time, may indicate the presence of an underlying disorder. You will need to see the doctor for a diagnosis in these situations. Water is essential for the natural and safe functioning of your body. Many of the body's vital functions, such as breathing and digestion, would be impossible to carry out without it. When you're dehydrated and these processes don't function properly, you can experience physical discomfort. Sleep deprivation may have a negative effect on your overall health. Every night, you should get at least 6 to 8 hours of sleep. Your body's tissues and cells, as well as your brain, need enough sleep to remain healthy and alert. Your body won't be able to relax and replenish vital energies and processes if you don't get enough sleep. When you don't get enough vitamin D, you can develop hypocalcemia, or a low blood calcium level. Calcium is needed for the proper functioning of many of your body's important organs, including your kidneys and muscles. Calcium is also important for the protection of your bones. You can experience aching in these organs and bones if you don't get enough vitamin D to help you absorb calcium. Number 3. Nausea. Nausea is stomach discomfort and the sensation of wanting to vomit. Nausea can be a precursor to vomiting the contents of the stomach. Nausea can be caused by a number of things. Some individuals are very sensitive to motion, as well as certain foods, drugs, and the side effects of certain medical conditions. Both of these stuff will make you feel nauseous. If the nausea is followed by heart attack symptoms, seek medical attention right away. Crushing chest pressure, an extreme headache, jaw pain, sweating, or pain in the left arm are all signs of a heart attack. If you have nausea along with a heavy headache, stiff neck, trouble breathing, or confusion, you should seek medical help right away. You should also see your physician if your nausea doesn't subside within 24 hours of trying over-the-counter interventions. Number 2. Swollen lymph nodes. Lymph nodes are small glands that filter lymph, the clear fluid that circulates through the lymphatic system. They become swollen in response to infection and tumors. Lymphatic fluid circulates through the lymphatic system, which is made of channels throughout your body that are similar to blood vessels. The lymph nodes are glands that store white blood cells. White blood cells are responsible for killing invading organisms. The lymph nodes act as a military checkpoint. When bacteria, viruses, and abnormal or diseased cells pass through the lymph channels, they are stopped at the node. Lymph nodes become swollen in response to illness, infection, or stress. Swollen lymph nodes are one sign that your lymphatic system is working to rid your body of the responsible agents. Swollen lymph nodes may become smaller on their own without any treatment. In some cases, the doctor may wish to monitor them without treatment. In the case of infections, you may be prescribed antibiotics or antiviral medications to eliminate the condition responsible for the swollen lymph nodes. Your doctor might also give you medications such as aspirin and ibuprofen to combat pain and inflammation. Number 1. Anaphylaxis. Although rare, some people have experienced more serious short-term side effects after getting a COVID-19 vaccine. For some people with severe allergies, exposure to their allergen can result in a life-threatening reaction called anaphylaxis. Anaphylaxis typically happens shortly after receiving the vaccine. Anaphylaxis causes a series of symptoms including a rash, low pulse, and shock, which is known as anaphylactic shock. This can be fatal if it isn't treated immediately. Your body is in constant contact with foreign substances. It produces antibodies to defend itself from these substances. In most cases, the body doesn't react to the antibodies being released. However, in the case of anaphylaxis, the immune system overreacts in a way that causes a full-body allergic reaction. People with anaphylaxis are given adrenaline, the generic term for epinephrine, medicine in the hospital to help them manage their symptoms. In addition, you may receive oxygen, cortisone, an antihistamine, or a fast-acting beta-agonist inhaler. The bottom line is that the COVID-19 vaccine was produced in less time than other vaccines. Many factors made this possible, including unprecedented scientific collaboration, a vast body of prior study, increased funding, and shortened timelines. Despite the quick development of the vaccine, no corners were cut with regard to the science. The current vaccines were still tested rigorously in human clinical trials in order to assess their safety and effectiveness. COVID-19 vaccination is critical for avoiding disease and preventing the spread of COVID-19. Consult your doctor if you have any doubts or concerns about the vaccine.